Hi, Dr. Regina Rodman here, and I'd like to talk today about some of the risks associated with a hairline advancement. Now, this is a surgery where I bring the hairline from its current position down lower on the forehead. Some people also call this a forehead reduction. The big risk with this surgery is scarring. Now, any surgery, anytime, risk of bleeding, scarring, and infection. With a hairline advancement, the risk of bleeding is real, but pretty low. That is why I have patients stay 2 nights after surgery in the Houston area after a hairline advancement. The scalp is very vascular. There is always a risk of bleeding. If it does bleed, I want to be the one to take care of you. I want to be the one to fix it. So that's why I like you to stay 2 nights after surgery, after a hairline advancement in town. After that, there is still a risk of bleeding, but it goes down quite a bit. So it's generally okay to get back on a plane or drive back home. Infection risk is pretty low. Again, the scalp is really vascular, so it's unlikely to get infected. You do get a dose of antibiotics through the IV before the procedure starts, and I do put patients on antibiotics afterwards to reduce the risk of infection. The big risk with a hairline advancement is scarring. Now, obviously, the goal of a hairline advancement is to make the scar as pretty, as discreet, and heal as well as possible. There's 2 parts that go into that. One is the part done by me, and so there's a few things that I do to help minimize the risk of scarring. One is I drill a little hole in the bone to anchor the scalp back down before I put any sutures in. And so what this does is it takes the stress off of the wound and off of the stitches and puts it onto the bone. So that's a really important technique that I have added that I think has really helped the outcomes. 2, I try to make sure that there is as minimal stress and tension on the wound as possible. So what that means is that I'm always balancing how much I can advance it, but without putting tension. And so I can almost always get at least 2 centimeters of advancement, sometimes more. I have done up to 4 in some patients. But every patient is different, and so I will advance it as much as I can without putting too much tension on the wound. And that just kind of depends on each patient's individual biology and anatomy, how much I'm able to pull it forward. I use what's called a trichophytic incision, and so what that means is I make the incision actually at a little bit of an angle, so the hair follicles stay in place under the incision. The new skin is brought up over, and ideally those little hair follicles still grow hairs which grow up through the scar, and that helps to minimize the visibility of the scar. Also, I use at least 3 layers, sometimes 4 layers of sutures in order to help the scar to heal as well as possible. Now, the first 2 layers are underneath the skin. They're in the galea, in the thick, tough part of the scalp. That's where all the tension is held, and that's what helps hold it together really well. There is then only a thin little layer of fine stitches that go through the skin just to help bring the edges together perfectly, help it to heal nicely. But those stitches come out at about somewhere between day 8 and 10. The other things that need to happen after a hairline advancement is it's really up to the patient to help care for that wound. And this is a big wound. It's a big scar, which heals really well if properly cared for, but it's a lot of responsibility on the patient. So things that the patients need to do is wash their hair. And what I recommend is that patients wash their hair the way that they normally would. So if you usually wash it once a week or every other week, and some of my patients with curly hair just don't wash it as often, stick to your normal routine because we don't want it to get too dry. What you can do if you don't wash your hair very often is just take a little hydrogen peroxide and clean the wound. Patients who wash their hair every day, every other day, should go ahead and do that because, again, we don't want it to get too oily or have changes in your scalp, which can create problems healing. So to wash your hair, I usually give patients Well, first I give patients all the supplies that they need to care for this wound, but in their little supply bag, I usually give patients some baby shampoo. That just helps for those first few washes, so that it doesn't burn and that it's just kind of a nice, like, mild product. Soon after the surgery, usually in about 10 days, patients can go back to their regular shampoo. So they have to wash it either with shampoo in the shower or with peroxide, usually both. And then most importantly, they need to keep the wound moisturized. So either with Vaseline or with Aquaphor. I don't actually like it to be something with an antibiotic like a bacitracin, just something greasy all over the wound. I tell patients if they come in looking like they're homeless and they haven't showered, then they're doing it right. I want all of that area to look really, really greasy, so I know that it's being moisturized, and that's what is going to help it to heal as well as possible. After the sutures come out, usually there'll be a few little spots that maybe need a couple more days to heal. I recommend that people keep an the ointment on those areas, so Vaseline or Aquaphor, for a few more days until they're totally sealed. And then once that happens, patients can then switch to scar gel. So we sell a product here, I don't really care what you use, as long as it's a silicone-based scar gel, and ideally it has some sunscreen in it. So this is a scar that you absolutely do not want to get sunburned, you do not want to get sun exposure, so keeping sunscreen on it all the time is really important. The scar gel helps to lock in moisture and moisturize the wound, but it's not as greasy as the Vaseline. So I like the scar gel as a transition because you can put makeup over it, or you can just wear it by itself and it doesn't look as obvious as the Vaseline. Patients really should plan to be wearing scar gel for a full year after the surgery. It takes a full year for the scar to remodel and shrink and to compress and to heal as well as possible. That whole time they should have sunscreen and scar gel on it. And so what that usually means is just applying it twice a day. So once in the morning before you go out, and then once at night before you go to bed. Now, there are also some supplementary things that we do that I think helps the scars to heal even better. We offer platelet-rich plasma, where we draw the blood, spin it down, take the red cells off, and then just leave the plasma. Re-inject that into the hairline to help the hair to grow and to help it to heal. The plasma has all kinds of growth factors and cytokines, all the good stuff of the blood. We re-inject that in a concentrated form in that area, which helps that wound to heal faster. And then if patients need to do some microneedling or dermabrasion to just help smooth out any kind of rough edges in the scar, we do that at the same time too. So those two treatments, we do up to 3 of those for each patient as they need it. And that is all just included as part of the package because we want the scar to heal as well as possible, and we want it to be as minimally visible as possible. Now, some of the risks, as I said, with hairline advancement is the scar. Now, there are 2 separate things that can happen with a hairline advancement. One is shock loss, and one is alopecia. Now, these are different things. So shock loss is kind of a diffuse thinning of the hair, and this is not a risk. This happens to some degree in almost every patient. Some patients have it a little worse than others, but this is not an area where there's a bald patch or there's no hair growing. This is because of a change in blood supply. A few more hairs grow into the sleeping phase than normal. So we always have hairs that they're in a constant life cycle where they're growing, and then eventually they go to sleep, and then eventually they fall out. Usually we have a small percentage of hairs that are sleeping and falling out. The change in blood supply drives more hairs to go into the sleeping phase, so you may notice more hairs in your brush, you may notice more hairs in the sink when you wash your hair. That's all okay, and it will grow back. So those hairs, the follicle is still there, just the hair has fallen out. The follicle is still there. It will grow a new hair. That hair will regrow. That's something I think that PRP really helps with, is it helps to boost the growth and like wake those hairs back up and get them to grow again. So that is only temporary. The other thing that can happen, that's the big risk, is alopecia or hair loss that is complete and can be permanent. So what that is usually in an area around the scar, the hair follicles get damaged, which is different from shock loss, which is where the hair just falls out, but the follicle is fine. In this case, the follicle gets potentially damaged and doesn't grow a hair. If that happens, or the other thing that can happen is if the scar gets a little wide or it doesn't quite heal the way that we want to, usually it's more obvious because scars or hairs do not grow in scars. So that is the risk with this procedure. If that happens, there's tons of things that we can do. It is fixable. It's why it's important that you come back and see me, that you come to your follow-up appointments so that I can make sure it's healing as well as possible. And if there's anything that we need to do, we can take action and do that. One of the options, if it's just a small area of a widened scar or area that isn't healing, what we'll often do is wait a few months, wait for everything to heal, see if the hair grows back. If it's still not growing back, if it's just a small area, we can often just numb it up with a little lidocaine and actually excise that area, put some nice stitches in. It usually heals really well. The other option, if it's an area either too big to excise, or if it's an area like say on the temples where patients want the hairline shape changed anyway, hair grafts can be a great solution. So we have a follicular unit extractor, so that's where we harvest hairs one by one, so you don't have the big strip or the big scar in the back of the head, and we can implant them in to any area where the hair isn't growing or isn't growing as well as we want it to. So I have had some patients, especially if they want their hairline more rounded, we'll do the advancement, and then even if they're happy with the scar, sometimes they will fill in the corners a little bit more or fill in the scar with some hair grafting. So that is always an option, and we generally offer it at a significant discount for patients who have undergone a hairline advancement, just to make the whole procedure smooth and the outcome as good as possible. The other not risk, but 100% guarantee, every patient that has this surgery will be numb on the top of their head. So this is something to just expect, and this is not a complication or something that went wrong in the surgery. The nerves that give sensation to the top of the head come up here, run up the eyebrows. They get cut in the hairline advancement. Now, there are other nerves that give sensation that come up from the side. There's nerves that come up from the back. Some of these do regrow and restore, and so that sensation won't necessarily last forever, but it will be numb or feel just weird, probably for several months, even up to a year. Now, these are sensory nerves. These are not nerves that move anything in your face, so it doesn't have any effect on your ability to do anything, work out, anything. But the thing to know is if you straighten your hair or curl your hair, it's important to just make sure, especially in that first year after surgery, that you're able to actually see what you're doing so that you don't get the hot iron too close to your scalp, because there's a risk of burning yourself. Other than that, it's really just kind of a thing where when you brush your hair, when you wash your hair, it just feels weird for a while. I've also had patients say that as it's healing and as the nerves are coming back, it starts to feel itchy. Some people say itchy, some people say tight, some people say burning. That's actually good. That's the nerves waking up and starting to fire again. But it can be really annoying because it's like an itch that you can't scratch. So a lot of patients go through that several months afterwards, which again, it's a good thing. It means that it's healing. It means that your sensation's coming back, but it can be just kind of an annoying thing, especially if you're laying down trying to sleep and your scalp itches, but you can't quite get to it. So those are the basics with the hairline advancement. Hairline advancement can be done at the same time and is often done at the same time as a brow lift. And we will talk about the risks of a brow lift in the next video.